Melissa Ward, and I'm going to be talking to you about trisomy 21, autosomal aneuploidy, abnormal number of chromosomes, specifically chromosome 21. The definition is a genetic disorder in which a person is born with 3 copies of the chromosome 21 instead of 2. Part of the body that does it generally affect? This is a trick question. It affects every part of the body pretty much. There's no one part of the body that is impacted by trisomy 21. There's some more common though. Structure of the head and face are most noticeable. The flat bridge of the nose, flattened face, short structure of the neck, upward slanted eyes, small rounded ears, a tongue that tends to be too large and can protrude from the mouth. Also noted that heart conditions are found in about half of all children born with Down syndrome. Some heart conditions are mild and some can be life-threatening or not compatible with life. There's brain structure, system and structure function issues, immune system problems, spinal cord abnormalities, thyroid, endocrinology, dental, ear, hearing, vision issues, and ultimately effects related to structural abnormalities. It is caused by random cell division occur that can come from both the mother egg or the father sperm, although the majority of cases seem to be noted to be associated with the egg and mother. Symptom description can vary. There's 3 different types. The most common is complete trisomy, where every cell in the body has the extra 21 chromosome. There's also mosaic and translocation. We're going to talk specifically about full trisomy 21. Side effects on the body are actually related more to the structural abnormalities, not necessarily the fact that there's that extra chromosome, and they can vary and range from mild to severe. The symptoms can progress as the patient ages. They're involved in developmental delays, poor muscle tone, loose joints, and short stature. There's often speech and language delays, as well as general difficulty with decision making and complex thought patterns. Ultimately, symptoms are related to the diseases and the illnesses that are accompanying the structural abnormalities. Cause of the disorder is complete random. It's a completely random issue with cell division that happens with the sperm and the egg cell. Risk factors, mutation. Ultimately, most trisomy babies are born to people under 35. However, being over 35, a carrier of the genetic translocation gene, or having a child already with Down syndrome is a higher risk. What happens in the body to cause the disease? Ultimately, it's related to the structural issues that extra chromosome causes within the organ systems. These abnormalities cause dysfunction in the development of the basic systems, and that leads to illness and disease. Examples are related to the flat facial features, small nose, small trachea, other lung structure issues, poor muscle tone, bad vascular structure, cognitive delays. So something as simple as a viral infection or a lower respiratory infection can be very troublesome, as their basic structures don't support very effective healing. How is it inherited? It is not sex linked. The chromosome is 21, that is got 3 copies, and it's not recessive or dominant. It is just purely the 3 copies, trisomy. How is it treated? It specifically is not treated. However, the illnesses and diseases due to the structural abnormalities are what is treated. Many medications are required to treat these illnesses and disease for trisomy 21, and they usually require more oxygen, steroids, antibiotics, CPAP, things like that because of the abnormalities. Generally, there's no gene therapy available. They do require a lot of specialists and primary care providers who are knowledgeable in that person's medical history, but also just understands trisomy abnormalities in general. How is it diagnosed? It's generally visualization in the ultrasound can be a trigger, as well as proteins in the mom's blood during pregnancy. And then chromosomal evaluation is the official diagnosis from amniotic fluid, placenta, and or umbilical cord sampling. Is genetic counseling an option? It is. There are genetic counselors for people who have a child already with trisomy, who are a carrier for the translocated gene, as well as parents who have had children who need support. Epidemiology would be that ultimately this is actually tracked by the state, not the United States, and approximately 1 in every 650 births, with a total of roughly 5,700 in every year. Research I found, it was a study on amniotic fluid metabolism in the 2nd trimester of trisomy 21. So this goes into cellular metabolism in utero and just the differences you can already see in the function in utero. And I will attach that link as well. Research, the National Institute of Health has a research plan that was developed in 2007, last reviewed in 2000. They looked at nearly 600 published studies. There were thousands. And they are just trying to pull things together on research that's going on across the globe, looking how it impacts things like the immune cells, T's and B's, basic structure, function, concepts, just down to appetite control and things like weight, mental health, etc. Here's my references. There were so many references available, and I appreciate you guys taking your time to learn a little bit more about trisomy 21. Thanks, and have a great day.